Hello and welcome to today's webinar, Digital Adoption in Healthcare, Reaction or Revolution? Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Brian Callis and Joshua Kraus. Brian is a managing director of digital health and innovation for Accenture's health strategy business. He is a frequent speaker on the topics of digital health, innovation, transparency, privacy and security, generational healthcare trends, and health information technology at leading graduate business schools, industry workshops, and conference events. Josh is a strategy director in Accenture's health strategy business. He has deep industry experience helping clients across the healthcare ecosystem to develop growth strategies, transform and build new business and care models, and bring an innovative mindset to address complex problems. He is passionate about blending strategy, technology, and human-centered design to improve experience and deliver greater outcomes across the industry. At this time, I would like to turn the floor over to our speakers. Welcome.
Thank you, and welcome everyone. We're honored to have you join us for the discussion today. Today, we're going to be sharing findings from our 2021 Accenture Health and Life Sciences Consumer Experience Survey. We'll begin with our learning objectives, then describe how the healthcare experience is changing during the global pandemic. Then we'll move on to discussing how moving digital technology adoption how to move from reaction to revolution, and then we'll open it up to discussion questions from all of you. So with that, let's dive into our learning objectives. We have 3 key learning objectives for today. First is to identify the key factors that influence positive healthcare experiences for people. Second is to discover trends that inform what's needed to leverage digital technologies beyond the current levels in the future. And the third is how to leverage the power of technology and human ingenuity to improve digital adoption, experiences, trust, and access in this new area. Now, we'll share some background about the survey. We've conducted the Accenture Health Consumer Experience Survey over multiple years to understand consumers' use, interest, and preference to use digital health for their health and health care. This year's survey included nearly 1,800 people in the United States and sought to explore how the healthcare experience is changing during the pandemic. Here's a sample of some of the key findings across the key themes of trust, tech, access, and experience. First, trust. We found that 3 in 4 people want to have a say in the usage of their health information. However, many people do not trust the organization that is currently using their health information. Technology, we found that greater than 25% of survey respondents did not use any digital technologies to manage their health in the past year. Access. 1 in 4 people we surveyed said their access to healthcare has been better since the onset of the pandemic. And last, experience. On experience, we found that 1 in 2 people say empathy is just as important as medical treatment when they think of their care experience. Overall, we surveyed over 12,000 people across 14 countries to understand their use, interest, and preference of digital health for their health and healthcare. Today, we'll focus on the results from the United States. Now let's look at Objective 1, how the healthcare experience is changing in light of the global pandemic. And as we mentioned before, we'll examine this across 4 areas in 4 key themes. So both technology, experience, access, and trust. And we'll begin with technology. So what happened to digital health adoption during the pandemic? Really, what we found is it's a mixed picture. Select technologies like virtual care and electronic health record use went up. However, the use of mobile apps or social-related technologies declined. Newer technologies like remote patient monitoring and digital therapeutics grew, but from a small base. Dive into this a bit. As you can see, virtual consultations and electronic health records were the top used digital technologies by people we surveyed. There's been a lot of discussion around the accelerated adoption of virtual care out of necessity due to the pandemic to help people get care from the safety of their homes, which this data supports. Interestingly, though, mobile-related and social media technology usage declined at the same time. This is a trend we started to see before the pandemic, as prior surveys found digital health adoption was stalling. However, we did find that some newer technologies, like remote patient monitoring and digital therapeutics, grew significantly, but from a small base, as you see on the slide here. So, what would make people more likely to use digital technology to manage their health? When we looked at this, we really saw two key things that stood out. One is just recommendations from your actual clinician or your doctor stood out as a key reason that a key thing people were looking for to adopt digital solutions. The second one was really that ties to trust related to data security and privacy. And this is a consistent theme we've seen over prior years, where people are really seeking that trusted recommendation of a digital solution from their doctor. However, in many cases, they're not getting that particular solution. Now, with that, we've also started to see the concept of a digital formulary emerging to address that need of getting that trusted clinical referral to people. So with that, now Josh will dive into findings about people's healthcare experiences. Josh?
Awesome. Thanks, Brian. So we're both super passionate about improving the human experience in the industry, and so excited to talk about this next theme, all about experience. So unsurprisingly to you all, better experiences can lead to better engagement with the health system for consumers, which can lead to better outcomes and increased loyalty for providers. And what we really wanted to look at was to explore what sort of experiences consumers have had over the past year. And given how the evolving needs of consumers have really changed since the onset of the pandemic and the continued maturation of the ecosystem to respond to these changing needs, there was a broad spectrum of different experiences that consumers have had, and checkered, right, both between positive and negative. We found that, fortunately, a third of the respondents actually did not have any negative health experiences this past year with a provider, pharmacy, or hospital. However, the majority had a negative experience, and for a variety of factors that we'll dig into. And of course, with these negative experiences come negative consequences, some more ephemeral, but some having more long-lasting consequences that could lead to poor outcomes, deferral of care, and switching behavior to actually find new alternative providers or treatments. So we wanted to really dig into this to understand those type of experiences. So when we talk about the negative, we'll start with the negative one with the positive. When we talk about the negative, and we asked what were those factors driving the negative experience, the top three that we found were that the visit was not efficient. A little under a fifth were around the medical advice was not helpful, and then rounded out by being surprised at the cost. Some of the other factors that we found were around ineffective treatment, emotional and convenience factors, and safety. Some initial takeaways is there wasn't really a predominant driving factor, meaning that there's no silver bullet for experience here, and health we know is personal. So you got to get a bunch of things right to avoid a negative experience. I think another thing to note is these three factors across these, there's a perception of value across these. So value in the time spent for consumers for making sure the visit was worthwhile, value in the type of advice that they're receiving that can be actionable, and value, of course, from a monetary standpoint. And so, I think we found this to be really important in general when it comes to value and thinking about that more holistically. Next, as I mentioned, there's negative consequences that come from these negative experiences. And so if you look on the far right here, 12% said there actually weren't any negative consequences. So the experiences kind of rolled off the back. But for the great majority, the 88%, there were negative consequences that came along with these experiences. So, one commonly, like we all feel, is being stressed and upset. But if you look at the middle two, there was the negative consequences of actually potentially putting off or deferring future medical care for when you need it, and even switching out medical providers or whole treatments. And I think these middle two are really, important, right? Because people may end up, the fact that of consumers not ending up going through with the treatment or having such an anxious or frustrating experience that it impacts future decision making of care can carry a lot of downstream implications from an outcomes perspective, from a cost perspective. To think about on the positive side, what were those factors that were driving a better experience? So when we asked consumers, what were the three of the following factors most important for your experience with a provider? We received, firstly, providers who explain their condition and treatment clearly. Seems simple, but I think from our research, we found this isn't necessarily a given the challenges with health literacy. Second was around providers who be able to provide that empathetic and emotional support. So beyond just the clinical diagnosis or treatment of care. And then came coordination of care, to help consumers navigate across an integrated and complex system. And then way down the line, actually the last factor that we found was around digital technologies, whether providers have those. So interesting findings here that when you think about digital, right, empathy on the other end was actually about 5 times as important to move the needle on driving that positive experience. There were other things that were in our survey as well around having a nice and clean office or helpful staff, important, but again, not moving the needle when it matters in terms of positive experience. So I think an implication here is for us is really when it's almost a back to the basics. Is making sure is how are you providing clear understanding to consumers if you're a provider? How are you providing that broader holistic care? Spending the time to understand more, the social and emotional needs for consumers before being, that's really to be able to provide that positive experience. It's having those in place before even moving on to kind of the tier 2 needs, which would be around digital. So with that, to round out experience, I'm going to pass it back over to Brian to talk about access.
Yeah, thanks, Josh. I think it was just interesting what you were stating on the positive experience side, just that importance of empathy and how strong that human connection is of the experience across this, which is interesting given we're talking about digital through this. If you flip it a bit too, tied to the negative experience, just that whole concept of a lot of the non-clinical aspects that create friction are adding stress and anxiety, just getting to an appointment or parking your car, getting in a space, paperwork, and how much friction that can add. Interesting. So as Josh mentioned, we'll now just dive into access and really look at both the combination of both access and affordability. So one of the areas we looked at was just how, what happened to healthcare access during the pandemic. And interestingly, we found that overall, healthcare system access showed resilience over the past year and really stayed strong, where people were stating they had high access to care on a general basis. However, there were challenges specifically related to both affordable and equitable access for all, which is a key concern and an area we need to focus on more. So with that, we'll dive a bit deeper into the access question and then look at affordability. So for access, most healthcare access was unchanged or even improved during the pandemic. 51% of the people we surveyed said there has been no change in their access to healthcare since the onset of COVID-19. However, and then 26% said their access actually improved, which we hypothesize could be attributed to virtual care or remote monitoring solutions. However, 20% said their access is slightly or much worse, which is an area we're looking to explore more deeply and more closely. So now let's look at the affordability side of the equation. Parts of all generations take actions that may negatively impact the health when they cannot afford healthcare. And that was an interesting insight when we looked at affordability. When people cannot afford the medical care or medications they need, we found that they often delay or decline treatment or medication or skip an appointment with a medical provider. Interestingly, Gen X is more likely to explore alternatives that impact their treatment than other generations when we look at the data. So with that, now Josh will dive into findings about people's trust of the healthcare system.
Awesome. Thanks, Brian. All right, trust. So this is our last theme, our research really focused on the impacts of the increase in virtual care due to the pandemic, and how did that change how consumers perceive the ecosystem and the value of health data. I think overall, the findings showed that people are more willing to share their personal health data if there are rewards, such as improving their health, gathering evidence about medication or treatment efficacy. And people generally trust their healthcare providers to handle their digital health information well, and are a lot less trusting when it comes to other ecosystem players such as tech, pharma, and government. And overall, I think the takeaway for us is that for the needle to really move on trust, that needs to really be in place to move the needle on digital adoption. Without trust, there's only such a ceiling for digital adoption to grow. So let's dive a little bit into the findings. So when we asked about how much to consumers do you trust the following stakeholders to keep digital health information, including things like EMR data, secure, these were the levels for those that answered very much. So very much trustworthy. So a few things that you can see right away is that providers and pharmacies lead the way as the highest trust for keeping digital information safe. Technology, pharma, and government entities are the lowest. Another thing that I think is interesting is that the trust levels have had fairly low variability across stakeholders within the 4-year time span. So trust has kind of remained fixed. I think the implications here are providers still remain the key channel for consumers, given the level of trust that's placed on them, both for safeguarding important information, but also reinforces our notions that the provider-patient relationship is so key for improving outcomes and adherence. So it's key for data, but it can be extended as kind of a microcosm to broader things that we would need healthcare providers to help with. On the big tech side, we're seeing a lot of inroads. They're making all the headlines in terms of extending beyond their public cloud platforms and into integrated services, from Amazon and Amazon Care and Pharmacy, or Google with Google Health and Care Studio, Microsoft with their Nuance acquisition. There's a lot of growth there from the tech perspective and making inroads, but we also see here that for solutions that become closer to the consumer, and the big tech growth may be hampered so long as trust levels remain low. And so that's something that they're going to have to combat, depending on the types of services that are provided and how much those are going to be kind of B2C models. Moving on is, what else do we know about data and consumer perception? So through our research, we know that people are more aware of the risks and the benefits. So when we asked consumers about considerations stemming from the increase in virtual care due to the pandemic, 73% said that they would have the right to, they should have the right to approve collection and use of PHI for any purpose beyond treatment. Based on the increase in virtual care, 64% said they are now considering more about data privacy and security needs. And finally, due to the pandemic and increased virtual needs, 54% agree that PHI is valuable. They see that as valuable as being to advanced research like pharma R&D. So I think a few key drivers that pop out here are, one, I think there's a heightened awareness of data. A lot of that comes from, on the negative side, data breaches across the industry. Healthcare is certainly not immune. I think over the last 12 months, there's been 700 some breaches, 4 million records breached per month. So it's hard not to be wary of security broadly, but particularly with the sensitivity of health information. Second is the heightened awareness of how data is being used. I think some of this is a bleed over from non-health, right? From social media platforms that we're seeing in the news and how important it is. We're getting asked on our apps whether we want to share information now. So I think some of that behavior and some of those things that are coming up in non-health settings are bleeding their way into this, and consumers are thinking more about data. And so implications here are, how might we continue to empower consumers to understand what data they have access to and how they can, one, protect it and use it for good and safe and meaningful ways. I think interoperability will help with increasing that over the coming years. And I think, health literacy still remains a challenge, but as literacy improves, there's going to be new models in place to help give line of sight in for consumers on how to be empowered in using their data, either for research or for their own betterment of their conditions. And a bit on pharma here. So we also wanted to look at and get a better understanding of pharma trust and collaboration with providers. And so when looking at that, consumer insights show that there's still quite a long ways to go when it comes to this perception. So there's a perception of lower collaboration between pharma and providers. But along with that, there's only a small amount of consumers that would want pharma companies to be part of managing their chronic illness. And only a very even smaller percentage of those that deem pharma to be trustworthy in how they market things. And even with pharma being at the center of a lot of the pandemic, of course, with vaccine rollout, trust is really stuck there pretty low with their perception of pharma. And so, to be able to get consumers to want to share more data with pharma or with some of these organizations, the pharma organizations are going to have to think about how do we build more trust, knowing that this is at still such a low level. And kind of with that is our research would be is how could pharma seek to increase trust? And so we found that it's really about making treatments more transparent and affordable. So when we asked which of the following would increase trust, the highest was around reducing cost for medications. It was around increasing transparency into pricing, clearer communication about medication treatment and effectiveness and side effects, and then transparency into the actual R&D. So it's really this broader theme around tell me where my money is going and help me understand what's happening in regards to my treatment process and R&D broadly. And so I think this falls in line with a lot of things that we talked about previously with the desire for affordability across the industry. It's that we're seeing in the industry across employers seeking new ways to curb costs and stem out-of-pocket burden on consumers. It positions pharma well to redefine the economic relationship with customers. How do they get involved in outcome-based risk for employers or for individuals? And transparency broadly, rising to the top, is also indicative of the broader call from across the ecosystem to remove the black box and helping consumers be a part of, allowing to drive their own journey. So with that, I'm going to turn it back over to Brian to sum things up.
Yeah, thanks, Josh. Before I kind of go into the summary, just want to thank everyone who's been putting questions in the chat window and encourage other questions that you may have from what we've shared today. Feel free to put additional questions in the chat, and we'll look to cover those after we wrap up the summary. As we discussed, we really looked across the areas of technology, experience, access, and trust during the discussion today and in the survey. So the real question comes into, well, how do we move, digital health adoption from both reaction to revolution? And how do we actually advance things from where they are at today to where they need to be? So if we look really across those same areas of technology, experience, access, and trust, kind of becomes a good framing of figuring out, well, what do we do next? So first on technology. Key insight here, a key next step is really to build on the gains that we've achieved, specifically in areas like virtual care and remote patient monitoring. We saw massive uptake in virtual care and even remote patient monitoring solutions out of necessity during COVID-19, and we're seeing some of that even sustain. Question is, how do we take the next step and really use that as rethinking care models and thinking about how we can blend both digital experiences and physical experiences really in new and different ways? Challenge. Second then is experience. And you heard, Josh mentioned a number of these things tied to the experience data points. But a big part of this, of both my passion, Josh's passion to improve experience, is how do you actually use human-centered design principles to design services with people, so both consumers and clinicians, to make sure that they're at the center of the service you're designing, with technology as an enabler. This is really about how do we actually create empathy, how do we create that connection, technology just being a backstage actor and enabler of it. And often that comes with a deep understanding of what are those humans' wants and needs. So the third then is access. So right now, as we noticed, people were generally satisfied with access when you looked at it. However, digital wasn't playing a major role. So I think there's an opportunity to strive to make digital access one of the top choices and really a key area of access go forward. And a lot of this can come through digital front door strategies, where it can be a first line to get a question answered, but also hand you off to different human, connections, whether it's virtual human connection or in your community or near your home. So then, lastly, tied to trust. Trust, everything Josh just mentioned, we have lack of trust is a major issue, and across all actors of the healthcare ecosystem, whether it's health plans, health providers, or pharmaceutical companies. There's really an opportunity, though, to leverage the trusted relationship of clinicians to drive improvements in digital health adoption, access, and experience. Even though there are trust issues across all stakeholders, the clinician still has the center where there is trust. And people are really stating they want that trusted advice from their clinician of digital tools that actually will help them meet their health or healthcare goals over time. So there's that question of how do we tap in to that trust and access of the clinician in new and different ways, and do so in a way that isn't adding additional burdens on what they're doing as part of their day-to-day. Big part of that comes back to what we stated related to experience. A lot of this can start with human-centered design principles, which really are grounded in design for equity and trust by co-designing services with users. The overall concept of service design adheres to the principles of not for us, without us. It's really key to figuring out how are you designing solutions for the end users that will be using the solution, and having them participate in the creation of those services. So with that, I will turn it over and start to go into the Q&A. If you have additional questions, feel free to put them in the chat. So one thing I'm going to start off with is there were a number of questions just related to the survey, the number of respondents and results. So I'll just restate some of that information from earlier. So overall, the survey covered 12,000 respondents across 14 countries. Of those 12,000, 1,800 were from the United States. And additional questions related to methodology can be found in the published report following this presentation. From there, Josh, I'm going to go to a number of questions also tied to equity specifically, and looking at just the social and emotional needs, both of medical staff as well as end users. Do you have any other, share additional perspectives on just, thoughts related to how do we ensure equitable experiences through technology, both for consumers and clinicians?
Yeah, for sure. I think one thing that we're seeing from an equity standpoint is around, and it ties to kind of new types of care models. And so what we're seeing is the rise of new narrow care models that are built around a condition state or around a unique patient population. And as part of that, building in, understanding of those unique needs to develop solutions to meet the patient where they are. And so knowing that they have complexity either to be able to get to in-person visits or SDOH related ones, it's building that narrow care model to be able to reach those patients and to be able to improve outcomes. So I think someone like a City Block, if you're familiar, is a good example of that. Is really designing it around the Medicaid complex patient population. It's all focused on reaching a previously hard to reach demographic and putting and wrapping a care model around that. Anything you would add, Brian?
No, I think it's a good summary. I'll go kind of to another question we're seeing out there just related to access, and I'll maybe frame the question in two ways. One is just related to increasing access overall for historically underserved populations, as well as the concept of tech access as the next social determinant of health. And Josh, I'll go ahead and take kind of the first pass on that. Tied to that question also is, are we seeing unique collaborations between payers, providers, or others in the ecosystem to try to address some of the access gaps? So one thing we have started to see, specifically as it relates to access to technology, especially as technology has been a lifeline for many of us in the pandemic, both for education, healthcare, entertainment, and connection to other people. We have started to see collaborations across health plans, providers, as well as other technology companies to ultimately provide access to broadband or smartphones and other devices as a way to address where there are gaps to that type of access as it being a necessity. For example, there is one government-sponsored health plan company that has worked with one of the mobile phone companies and mobile phone providers to actually deliver smartphones to people who do not have them as a way to give them broadband access in different areas to connect them for both health and non-health purposes. Result. And we're seeing a number of different collaborations of that nature. If I flip it a bit to access, specifically to access in the home and in the community, regardless of technology, we're also seeing an increased growth in care models that are focused on providing care at home, regardless of what the technology situation is of the individual. That can start with lower acuity conditions of just getting general care at home, all the way up to high acuity, where you're seeing hospital at home models starting to emerge as a way to provide care closer to where people are at. Josh, maybe on that front, do you have any either comments or things you would add related to things we're seeing related to care at home?
Yeah, I think building on what you said, which I think is great, is the kind of all the surrounding. I think we're at the early innings of care at home. So we're seeing obviously the things like wraparound services, ancillary services with pharmacy to your door. We're seeing the ability to start having supplies and durable medical equipment sent home to wrap around either a virtual visit or an in-person visit. So I think just more and more supply chain and logistics that are going to be maturing to allow for location independent care and care around the home. And then one other thing maybe to add, Brian, that I think is interesting around access from an employer standpoint is kind of putting in these kind of like a front door where it's much more around the care advocacy, helping help my employees navigate and figure out where to go based on a need that I have. So they're not left scanning a provider directory. So taking kind of the frustration and negative experience with that, and then helping figure out with quality matching for providers, figuring out the right setting of care. So I think a lot of that around the steerage and front door solutions for employers are going to help, hopefully, with improving those downstream experiences for employees, members.
Yeah, thanks, Josh. Just to add, there are a couple other comments coming in the chat as well. We had a lot of survey data that we discussed related to just trust, and in particular the use of people's health information. And wasn't necessarily a question, but a statement that we see as an opportunity is this ties to the increase of data breaches and the impact of that, and making cybersecurity a key area of focus. I know one potential challenge or opportunity is whether or not we need to look at the magnitude of fines that different organizations receive. And the question is, are those fines or penalties high enough to actually drive the changes in behavior related to improved cybersecurity behaviors? And that is definitely an open area that we're seeing many people explore, and that could start to drive change there. A second piece then was also just related to, here, let me see one second here. Related to access to pharmaceuticals and so forth. And I think there's definitely opportunities of different ways to open up, different ways to negotiate, to change the pricing situation of pharmaceuticals across the country, and not a lot of different solutions are being explored on that front. Maybe I'll look to see if there are other questions that come in, but Josh, maybe one last question for you. When I wrapped up, there's the comment of just blending digital and physical, and really this need to rethink care models. That also is what we're seeing tied to equity as well, as there are a number of different questions coming in tied to equity. How are you seeing kind of this blending, this rethink of new care models? You mentioned City Block, and we've also talked a bit about care at home. What else are you seeing out there?
Yeah, no, I think there's exactly. I think the flexibility, or call it the location-independent care models that are cropping up, and vertical across different condition states. So we're seeing some of that around, at least on the virtual side, a lot around the musculoskeletal vertical. So thinking about like a Hinge Health, where it's really meet the consumer where they are, and if they need any in-person visits, then they can get those as well. And then thinking about kidney care, thinking about women's health as well. So we're seeing the interesting models around whether it's a Tia or a Maven. It's I'm busy, and it's kind of the convenience that meets my needs at the time, but maybe I need an in-person visit as well. So I think the interesting care models that are coming up are virtual first, that help with the on-demand nature of life, but having that backdrop to be able to get in-person care when needed for more acute needs.
Yeah, Josh, and building off what you stated, is a lot of those virtual first models we're seeing are really blending, the across the three themes we mentioned of technology, experience, access, and trust. And many of them are also targeting historically underserved needs, which hit the equity component that is discussed in the slides, as well as some questions coming in the chat. So Josh, you mentioned women's health. We're seeing full virtual care models focused on women's health as one area. We're also seeing the emergence of full virtual primary care models tailored to people of color. We're seeing full virtual care models focusing on LGBTQIA+ populations, et cetera. There's kind of this emergence of that. We're also seeing just general use virtual primary care starting to be embedded in health plan benefit products, as something that really went from small scale experiments prior to the pandemic, and now you're seeing it grow in its overall adoption at a national level. Going back, another question just related to the number of people surveyed. So just for reference, again, there were 1,800 people that were surveyed in the United States out of a total of 12,000. the data points you were seeing on the slide were from that 1,800 national sample across the United States.
And there was a mix.
Yeah,
Oh,
go ahead.
I was saying, and within that population, there's a mix of those that have a chronic condition and those don't as well. So there's a good catchment of that.
Yeah, I'll close up with just there was one last question related to care models that are targeting low-income Medicaid populations. Some of those you may have heard me verbalize, and then Josh mentioned earlier City Block, which has a blend of physical community-based care plus digital kind of combined, which is focused on Medicaid as one example. We're also seeing new care models emerge that are targeting, as well as benefit plans that are targeting people who are in transit between or in transition between homes. So both homeless or people in transition from homes as solutions. And there's typically a blend of both mobile clinic type solutions as well as we've seen just virtual care being embedded in different community-based spaces, whether it's homeless shelters as others, well, to have care provided in those spaces, as well as mobile clinics that would alternate around. So I think with that, just kind of to recap, in general, what we saw from the survey is we're increasingly, we explored the areas of technology adoption, experience, access, and trust. When you look at the technology adoption area, we actually saw prior to COVID a stalling of people's use of digital technologies for their health and healthcare. COVID introduced a large spike in the use of virtual care as well as electronic health record usage, which we see sustaining, while also seeing a drop in mobile health app use and social, which we're watching to understand what is driving that trend. On the experience side, there's really an opportunity to introduce empathy as a strong connection to focus on positive experiences, as well as designing ways to remove a lot of the friction that can add stress and anxiety, driving a negative experience. And that includes a lot of administrative aspects of getting to care if you are showing to a physical place, parking, paperwork, etc. Everything that is wrapped around the care experience, but not really tied to the actual. And then on access and trust, there's the opportunity to leverage trusted relationship of clinicians to ultimately improve access to care, and then really tie in ecosystems as a way to address gaps, where it's gaps in access to technology or gaps in access to care, and really coming together as joint solutions to be able to provide. With that, I want to thank everyone for joining the conversation today, for joining Josh and I for the discussion. Additional questions, if you have related to the survey respondents, you can find in the full report that you can access publicly. And thank you for your time and the discussion today. Have a good day.
Thanks all.
Thank you for that great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of the day.